Hello, my name is Ivy. I'm a fourth year social work student at Toronto Metropolitan University. I'm currently completing my placement with Organization for a Safer Space. Today, I will be talking about eating disorders. In this video, we'll first look at what an eating disorder is. We'll then look at the risk factors and causes, the types of eating disorders and their symptoms, effects, treatment, and lastly, we'll look at some coping strategies. Eating disorders are a range of conditions that result in unhealthy relationships with food, weight, and appearance. Eating disorders can hinder people's health, interpersonal relationships, and daily living. In extreme cases, eating disorders can become life-threatening if left untreated. In the United States, approximately 30 million people have an eating disorder. In fact, 95% of these people are between the ages of 12 to 25. The types of eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorder. These will be discussed later in this video. Risk factors and causes. The most common risk factor for developing an eating disorder is genetics. Having a family member with an eating disorder increases one's chance of developing it as well. Other factors can include emotional, physical, or sexual trauma, bullying, dieting, puberty, major life changes such as starting college or getting a divorce, negative self-image, weight stigma, perfectionism, cultural beauty standards, peer pressure regarding weight gain, involvement in activities involving slender appearances such as gymnastics or modeling, stress, anxiety, depression, and obsessive compulsive disorder. The types of eating disorders and symptoms. Anorexia nervosa is a condition in which people severely avoid, restrict, or eat small portions of food to the point of starvation. People with anorexia nervosa aim to lose weight and refuse to eat adequate amounts of food for their body. Anorexia nervosa is the most fatal type of eating disorder due to complications linked to starvation and suicide. The symptoms for anorexia nervosa include severe restrictive eating, extreme thinness, a continuous desire of thinness, and resistance to be a healthy weight, extreme fear of weight gain, distorted body image, low self-esteem, and refusal to accept the severity of one's low weight. Bulimia nervosa is a condition in which people have frequent episodes of eating large amounts of food for a short period of time, which then results in forced vomiting, using laxatives, fasting, or exercising to eliminate the eaten food. The symptoms for bulimia nervosa include chronic sore throat, gastrointestinal problems, intestinal irritation due to laxative use, and extreme dehydration. Binge eating disorder is a condition in which people have frequent episodes of eating large amounts of food. However, they do not purge, fast, or exercise excessively, unlike bulimia nervosa. This results in people being overweight or obese. The symptoms for binge eating disorder include eating excessive amounts of food in a certain period of time, eating when full or not hungry, eating quickly during binge eating episodes, eating past comfortable fullness, eating secretly or unaccompanied to prevent embarrassment, and experiencing shame, guilt, or distress about eating. Other general symptoms of eating disorders include fatigue, dizziness, fainting, mood swings, thinning hair or hair loss, drastic weight loss, and sweating or hot flashes. Effects. Eating disorders are the second most fatal psychiatric disorders. Severe calorie restriction, purging, and excessive exercise can hinder one's health. Eating disorders can increase a person's risk of developing the following: heart issues, gastrointestinal issues, acid reflux, cardiovascular problems, extreme dehydration, dental problems, hair loss, fainting spells, stops of menstrual cycle, osteoporosis, organ failure, brain damage, and death. Treatment. Cognitive behavioral therapy is a common treatment for eating disorders. This type of therapy helps patients understand and change their thoughts, feelings, and behaviors. Family-based therapy is beneficial for children and adolescents with eating disorders, as parents can learn to provide meal support to aid in recovery at home. Nutritional therapy partners patients with registered dietitians to help them learn how to eat healthy and motivate them to make changes. A healthcare professional may prescribe medication to treat co-occurring conditions such as anxiety or depression. Coping strategies. To cope with eating disorders, it is important to seek support from family and friends to aid in one's recovery. It is also beneficial to engage in activities that can distract oneself from obsessing about food and weight or engaging in disordered eating. Activities can include journaling, trying a new hobby such as painting, engaging in mindfulness, reading self-development books, listening to a podcast, educating oneself about nutrition, and engaging in physical activities. If you have any of the symptoms described in this video, it is important to seek help. Feel free to check out the organization For a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.